And it's Rebecca. Hi. I haven't posted a video in a few days, and so I wanted to post one. It's kind of been a crazy few days. Lots going on. I play with my hands when I talk. It's really bad. Sorry. I sort of have had a few rough days. Probably like 4 or 5, if I'm going to be honest. Luckily I haven't gained too much weight. Maybe I keep bouncing within the same few pounds anyway, so really staying within that. So yeah, that's good. I'll basically tell you the story. So I have been trying to do a lot of research on polycystic ovarian syndrome while I'm trying to eat healthy and exercise and figure out, what is it that's going to work for my body to lose weight. Lots of people have told me, it's calories in, calories out. That's how I lost the weight and exercise. Yeah, it comes off slower, but it's definitely doable. And a few years ago, about 4-ish or so years ago, between 2010 and 2011, there we go, I lost about 70, 80 pounds-ish, somewhere in there. I had done a Christian discipleship program at the time, and I went into the program at 312 pounds, I think was my heaviest. And when I graduated, I was somewhere between 240, 250. The numbers aren't exact, but so I had lost a lot of weight. But they sort of controlled our diet, and we did exercise every day. And a lot of the stressors of life were taken away because you're sort of in this little bubble, so you don't have sort of the everyday things that you would normally. So I know it's possible to lose the weight. I just don't know the right combinations or the best ways to do it necessarily. So I'm doing lots of research to try and figure things out. So I make a doctor's appointment to talk to my doctor because I had her send us to a fertility specialist because we really wanted to try getting pregnant. And the fertility specialist basically came in, sat down, looked at me, looked at my body, didn't look at the numbers, like my blood pressure or anything. Basically said, oh, you have high blood pressure, which I never have. I'm a 120 on 80, even at 330 some odd, 340 pounds. My blood pressure's always been right where it should be, or within a few numbers. I've never had any high blood pressure, never had high cholesterol. I don't have diabetes. I get tested frequently for that. I've had one scare where my numbers were a little bit elevated, and they did another set of blood work, and it was perfectly fine again. So I've never had it. I do try to watch what I'm doing so that I don't get it even at this weight. But anyways, and he just basically was like, well, your only option is weight loss surgery because people like you don't have the energy to exercise, which I have to say really kind of pissed me off because he didn't know me. He didn't try to talk to me about anything. And when I was like, well, can you offer me any other help? It was like, nope, this is your only option, and that's it. And we can't help you get pregnant until your BMI is basically I'd have to be probably about 170 before they would help my husband and I to get pregnant because it looks like one of our only options is going for in vitro fertilization. And not just because of me, but because there's multiple compound issues and stuff like that. So anyways, so I was like, oh, okay. And he's like, just trust me. I send a lot of my patients to do this. They come back. I don't even recognize them. They don't even need me to get them pregnant, blah, blah, blah. Which then I don't know why he's seeing them after they have the surgery. That didn't make sense to me. But anyways, so I made an appointment with my family doctor. I went in with 2 things to talk to her about because I fell down the stairs 2 years ago. We had a huge fire in our city. It kind of made international news. It was crazy, and it was on my street. So we had to evacuate our house. And we were at a friend's house, and I woke up the next morning, and when you're in a strange place, and you're half asleep, and you haven't had coffee yet, and you're trying to talk, do not talk and try to walk downstairs. So I fell down the stairs, and injured my knee. I was on crutches for a while, and then the knee injury never really, like, hasn't really healed properly, or never really went away. It started to get better, and then as I start to exercise more, of course it starts hurting again. Well, it's not really surprising when you are my size. But, you know, there's got to be something that I can do so I can continue to exercise to try and get healthy. And so I wanted to go to my doctor to talk about my knee injury and talk about my polycystic ovarian syndrome, sorry. And I went in, and she just, I don't know if she wasn't having a good day, what the issue was, but basically I tried to talk to her about what the doctor had said to me and how I was not okay with the way he treated me. I'm sort of giving you the Coles Notes version, so if you're one of my friends and you've seen this, you've heard the story, you know sort of exactly what happened, and it wasn't pretty. And my doctor basically was like, he's right, your only option is weight loss surgery. And when I was like, well, can you not send me to an endocrinologist or a dietitian, somebody who works with polycystic ovarian syndrome, I got told, oh, well, a dietitian isn't going to work with you, isn't going to work for you. And I'm like, pretty sure a dietitian works for everybody, no matter where you are in life. Getting tips on healthy eating, not such a bad thing. So, kind of like, okay, whatever. She didn't even look at my knee. She was ranting and raving about a couple other things that I had to, like, bring to her attention and whatever, and she just really was not good, not supportive, and my only option apparently is gastric bypass surgery, and I should get it as soon as possible. So I'm like, oh, well, okay, fine. So I left the appointment. I was really upset. I was really hurt. I was really frustrated. For those who are on my Facebook, you know that. And I do want to talk to the right people about what she did, because there was a few different things in there that just were very unprofessional, that she said to me. But I think what frustrated me was being told basically, like, I'm not willing to send you to anybody or get you any other help. You just have to get surgery. So the last few days, I have to totally be honest and say, major pity party, definitely frustrated. I've been in a lot of pain, so I didn't want to exercise, and just like, you know what, if I'm not going to lose weight anyways, I'm going to eat whatever I want. So, which is funny, because in that I still tried to make some healthier decisions, but I did eat, you know, like ice cream, and I had pizza, like, so it wasn't the greatest, although it was the weekend as well, so not always the greatest anyways. But definitely did some emotional eating. Not proud of that, but you know what? We can bounce back from that. It is possible to bounce back from that. So what I've decided, I think the only thing that I can do at this point is continue to do research on polycystic ovarian syndrome, the best sort of diet tips that I can come up with. I don't have a lot of money, so I can't just be like, oh, I'm going to go over and try this diet. No, I'm going to go over and try this diet. I have to sort of modify with what I have in the house already, and then I can sort of integrate things if I find that they're working the next time I go to buy groceries. My husband only gets paid once a month, so it gets a little, like, it's hard to try to, like, budget grocery, anyways. So I want to try some stuff, try a couple different things, or do some research into a couple different things, see what's out there that might work. But I definitely want to, like, try to keep eating healthy and exercising, even if I am going for weight loss surgery, because some of the stuff I've read is that they want you to be, like, as healthy going in, because it helps with recovery and shrinking, like, if you have a fatty liver, shrinking that down and stuff. So no matter what, I think I really need to stick to eating healthy and exercising, and I can talk to the people at the weight loss clinic, see what they say. They may be willing to work with me in different ways. We'll see what happens, but I wanted to give you that update, and just be honest and real that life isn't always easy, and you know, we struggle, and this journey is going to have a lot of ups and downs. It's going to have a lot of good days and probably some bad days. But I am going to get my workout in today. I'm already wearing workout clothes, and I need to clean my house, which is also a workout. So I'm going to do like a few things today, but yeah, that's basically sort of where I'm at. If anybody has any sort of tips or things, you know, if you have polycystic ovarian syndrome and you're watching this and you're like, yeah, I was at your weight and now I've lost weight, or whatever, and you found certain exercises that have helped, or you've come across like nutrition articles or whatever, please comment below. Let me know. I'm always interested. I'm always looking to talk to people, because the more people you talk to with different experiences, the more you can gain knowledge. And I like real life knowledge from people instead of just articles written by doctors who may have never experienced it. So please comment. Let me know. If you like the topics that I have, please subscribe. The support really helps. It keeps me motivated, actually. I check all the time to see what the comments are and who's following and stuff, because it keeps me accountable. It keeps me like, I need to be doing this because people are watching me. So please comment, share, like, subscribe, definitely subscribe, and let me know if there's anything specifically you want me to talk about, and I'll try and do my best. Anyways, I hope you're all doing so well. Thank you all for the comments I've already got. You guys are awesome. Thank you, and let's do this. We can do this.